Good evening, guys. I've got a bonus one for you, D, and it deals with prevalence of chronic pain for folks who have chronic pain. This is a presentation for you all. Okay. Title: Prevalence of chronic pain. About 1 in 4 Americans suffer from chronic pain. For 1 in 10, the pain is so severe it impacts work, social life, and mental health. Challenges in treatment. Chronic pain is difficult to manage and often leads to feelings of isolation, anxiety, and depression. Some patients may develop substance use disorders due to inadequate relief. New research direction. Give me 1 second. Experts at the University of Colorado and Schultz Medical Campus are pushing a paradigm shift in how chronic pain is treated. The emphasis emphasized the role of the brain in pain perception and management, arguing it's overloaded. It's often overloaded. Psychological approach to pain. Dr. Yanni Ashar highlights how benefits about being stuck in pain hinder recovery, encouraging inactive treatment mindset may boost outcomes. Clinical advances. Dr. Joseph Frank notes improvements in diagnostics and patient interactions. Supporting more personalized care pathways. This focus on cognitive and psychological dimensions of pain aligns with your interests in interdisciplinary health strategies, especially those that bridge neuroscience, mental health, and rehabilitative care. Would you like to explore how these approaches tie into frailty-aware, memory-friendly frameworks? The brain plays a central role in chronic pain, not just in perceiving it, but in shaping how it persists and how we can be treated. Here's how brain involvement affects treatment strategies. Okay, chronic pain as a learned brain response. Neuroplasticity. The brain can learn pain through repeated signals even after injury heals. This leads to central sensations, centralizations, where the nervous system becomes hypersensitive. Pain becomes a loop instead of being a symptom of an injury. Pain can become a syndrome in its own right, maintained by brain circuits. Psychological and cognitive therapies. Pain reprocessing therapy helps the brain reinterpret pain signals as non-threatening. Studies show 66 to 73% of participants report being mostly or completely pain-free after PRT, cognitive behavioral therapy. CBT alters brain networks tied to pain and emotion, reducing harmful thoughts patterns and improving quality of life. Somatic tracking encourages mindful attention to pain with a sense of safety, helping the brain unlearn pain associations. Brain pathways and emotional pain. Thalamus amygdala circuit. New research shows that emotional suffering from pain is mediated by a specific brain pathway involving OGRP expressing neurons. Emotional tone of pain. This pathway explains why pain can feel more intense when paired with anxiety, depression, or trauma. Innovative neuromodulation techniques. Scrambler therapy uses electrical stimulation to reset pain signals in the brain. Up to 90% of patients report significant relief. fMRI evidence. Brain scans show reduced activity in pain processing regions after therapies like PRT and CBT. The brain-centered approach aligns beautifully with your interest in systems based neuroscience and neuroplasticity driven rehabilitation. Would you like to explore how these therapies could be integrated into frailty aware or memory friendly care models? Neuroplasticity, the brain's ability to rewire itself, offers a powerful pathway for treating chronic pain by shifting how pain is processed and perceived. Here's how it works. Rewiring the pain pathways. Central centralization in chronic pain in the brain may become hypersensitive, amplifying pain signals even after the original injury heals. Neuroplasticity allows reversal. With targeted therapies, the brain can unlearn maladaptive pain responses and form new, healthier neural connections. Therapeutic strategies that leverage neuroplasticity. Pain processing therapy helps patients reinterpret pain as non-threatening. In a 2021 study, 66% of participants became nearly or completely pain-free after just 4 weeks. Okay, fMRI scans showed reduced activity in pain processing regions and increased activity in areas linked to positive emotions. Cognitive behavior therapy, or CBT, alters thought patterns and emotional responses tied to pain, encourages adaptive coping strategies that reshape brain circuits, mindfulness and somatic tracking, promotes safe, non-judgmental awareness of pain, helps deactivate fear-based pain loops, and restore balance in the nervous system. Neuromodulation techniques. Transcranial magnetic stimulation, or TIMS, and transcranial direct current stimulation, TDOCS. Non-invasive methods that stimulate specific brain regions in reducing pain sensitivity can reduce long-term changes in neuroplasticity with repeated sessions. Scrambler therapy sends non-pain signals to the brain via electrodes, retraining it to interpret sensations differently. Emotional and environmental triggers. Neuroplastic pain often arises from stress, trauma, or emotional distress, not just physical injury. The brain may associate neural stimuli like sounds or weather with pain, but Neuroplasticity allows these associations to be reprogrammed. This approach resonates deeply with your system-based neuroscience lens. Is not just about symptom relief, it's about restoring autonomy and emotional resilience. Would you like to explore how these therapies could be adapted for memory-friendly or frailty-aware care environments? Neuroplasticity, the brain's ability to rewire itself, offers a powerful pathway for treating chronic pain by shifting how pain is processed and perceived. Here's how it works. Rewriting the pain pathways. Centralization in chronic pain. The brain may become hypersensitive, amplifying pain signals even after the original injury heals. Neuroplasticity allows reversal with targeted therapies. The brain can unlearn maladaptive pain responses and form new, healthier neural connections. Therapeutic strategies that leverage neuroplasticity. Pain processing therapy helps patients reinterpret pain as a non-threatening. Okay. Neuromodulation techniques. Transcranial magnetic stimulation and transcranial direct current stimulation. Okay. That one already did. The brain may associate neural stimuli like sounds or weather with pain, but neuroplasticity allows associations to be reprogrammed. Guys, this one will be the last one for the night. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.